Pharmacist Scott Coulter says vaccinations started out busy this season but have tapered off. He says he expects interest to grow once again as influenza cases spike.
Absolutely. People are responding to the news, no doubt about that. They're responding to the fact that their friends and loved ones are getting very sick with the flu as well.
According to the Middlesex London Health Unit, there were 150 cases of influenza in the first week of December for a total of 486 so far this season. There were 39 new hospitalizations, and the positivity rate was nearly 30% of those tested.
We're starting to see an earlier rise in the number of influenza cases compared to last year, for example. And so we're having increasing cases week after week, and we've been noticing this for the last several weeks now.
The head of Children's Emerge at LHSC says children are often affected first by the flu, and right now that is putting a strain on Children's Emerge.
And we've seen up to almost 200 patients in a day, mostly with flu-like symptoms. So we've definitely felt the impact of the flu this year, like we do it every year.
Dr. Lim says those most vulnerable include patients being treated for serious illness or elderly patients. For that reason, LHSC is asking people to wear a mask in clinical areas. Situation is essentially the same in neighboring Elgin and Oxford counties, where public health officials are warning of a very high influenza risk. Infectious disease manager Joanne Andrews says congregate settings have been impacted by the early surge.
And we're seeing that impact not only hospitalizations, but also outbreaks in our long-term care home and retirement homes. So right now in Southwestern Public Health Region, we have 5 facilities that have an influenza A outbreak.
Health officials say they expect a peak by late December in the middle of the holiday season, so it's not too late to get your shot.
We anticipate this to continue for a few more weeks as we enter a peak of influenza activity.
We hope to see as many people vaccinated as possible. We're certainly prepared if that happens.
Bryan Bicknell, CTV News.